How can we address sunken or hollow eyes non-surgically? Now, the first thing I would say is that sometimes, and particularly here we're talking about when the eye seems to almost sink back into the skull, and you notice that often around the upper eyelid. The eye area is really delicate, and like everything on the face, every layer around the eye changes. So when we think about skin thinning, this starts from our mid-20s and we lose collagen and elastin. Bearing in mind the skin around the eye is already the thinnest on the whole face, that can have a really marked result. Next is that the fat pads of the whole face tend to both deflate and also migrate southwards. So the support in the cheek becomes less because the fat pads sit lower, and also this deflation of the actual fat pads around the tear trough can lead to hollowing. And the same is also true around the upper eyelid. And then come the bony changes, and these tend to happen maybe slightly later, through our early 40s a lot of the time, but this bone resorption means that the entire shape of the eye socket changes, where in youth it's a little smaller and tilted upwards. As we age, it becomes a bit bigger and tilted downwards, and that affects the shape of the eye area, and it also affects the messaging of the face, because we go from having this sort of upward tilt to having often this slightly more sunken and downturned look to the eye area. It's important not just to assume that that's something that's bothering you aesthetically. It can be a sign of various health conditions, and especially important is if you notice it on one side and not the other, to go and have a general medical checkup before just assuming this is something that can be fixed with an aesthetic procedure. When it comes to addressing hollowing around the eye area, we have a few options depending on the degree of hollowing. One is that we think about something as gentle as polynucleotides. Polynucleotides are a regenerative injectable made of fragments of DNA, and these can be injected around the eye area to help provide some density to the tissue by replenishing collagen and elastin levels. The result on hollowness is usually subtle. It's not as dramatic as other techniques, but if you just have a little bit of hollowing and you're wanting to avoid anything more invasive than that, they may be a good choice for you. Next up, and the mainstay of non-surgical treatments when it comes to hollowing, is filler. We've talked in the past about filler for hollowing around the tear trough area, and the first thing I would say is around the whole eye area, the same has to apply, that we look at the structure first, look at the temples, look at the cheeks, provide a framework back to the face before thinking about working directly around the more delicate eye area. We can treat the under eye area in many cases with some gentle tear trough filler, aiming to improve, not to eradicate, but also realizing that if you're someone prone to puffiness around the eyes, then these products are probably not going to be the right choice for you. Many people don't realize that we can also use hyaluronic acid fillers around a sunken upper eyelid, and this is something that's often referred to as A-frame filler. It's a very advanced technique, and it's very delicate and precise, and should only be in the hands of someone very experienced in doing it. Last but not least is to consider fat grafting, because when we look at fillers, they are a temporary treatment that needs repeating over time. And if you're not afraid of a surgical procedure, or you're someone who's also maybe having a facelift and therefore you're going through a surgical procedure anyway, you could combine that with strategic fat grafting. And fat grafting involves the harvesting of fat from elsewhere on the body through liposuction, and then that can be re-injected into areas of the face. And this comes with pros and cons. One is when it's done well, the longevity is excellent. The con is when it's done badly, the longevity is excellent. And so I have unfortunately also looked after people with lumps and bumps that can be very difficult to treat. But in the hands of a great surgeon, fat grafting can provide an excellent and long-lasting result. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.